Somewhere in the Thar Desert of western India, a plant no taller than your hand is quietly producing seeds worth $400 million a year in exports. A single teaspoon of powder from those seeds can absorb 40 times its own weight in water, turning a glass of liquid into a trembling, translucent gel in under 60 seconds. That gel has been prescribed by Ayurvedic physicians since the 16th century, earned an FDA health claim for heart disease prevention, and recently gone viral on TikTok under a name it does not deserve: Natural Ozempic. Today, I'm pulling Plantago ovata, psyllium, isabgol, desert Indian wheat, out of the supplement aisle and putting it under the microscope. What this seed does to your cholesterol, your blood sugar, and your gut bacteria is remarkable. What it can do to your esophagus if you use it wrong is terrifying. First, the molecular sponge. What happens when you drop a teaspoon of psyllium husk into a glass of water? You get a physics lesson disguised as breakfast. The husk of Plantago ovata is roughly 85 to 90% fiber by dry weight. Of that fiber, about 70 to 80% is soluble, a ratio almost unheard of in the plant kingdom. The dominant molecule is arabinoxylan, a branched polysaccharide built from arabinose and xylose sugars, linked into a structure that, under a microscope, looks like a tree that grew sideways. When arabinoxylan contacts water, it does something most fibers do not. It forms a viscous, non-fermentable gel. Not a paste, not a slurry, a genuine hydrogel, a three-dimensional molecular net that traps water inside itself and refuses to let go. Think of it as a biological sponge with an engineering degree. Unlike cellulose, which moves through you like a broom, or inulin, which gets devoured by gut bacteria before it reaches the finish line, psyllium's gel travels nearly intact from your stomach, through your small intestine, and into your colon. Along the way, it's doing work at every checkpoint. In the stomach, the gel increases viscosity of the chyme, the partially digested slurry that your body pushes downstream. Higher viscosity means slower gastric emptying. Slower emptying means you feel full longer. In the small intestine, that same gel physically slows the interaction between digestive enzymes and nutrients. Imagine a crowd trying to get through a hallway that's been filled with transparent gelatin. Everyone still gets through, but not nearly as fast. That delay is measurable. A landmark study showed that the reduction in postprandial blood glucose rise was directly correlated with gel viscosity, with a correlation coefficient of 0.926, nearly perfect. The thicker the gel, the flatter the sugar spike. But the gel's most paradoxical trick happens in the colon. Here's where things get counterintuitive. This single substance treats both constipation and diarrhea. When stool is too dry and hard, the gel adds water and softens it. When stool is too loose and watery, the gel absorbs excess fluid and firms it up. In a head-to-head trial, psyllium proved superior to docusate sodium for treating chronic constipation. For fecal incontinence, the firm randomized crossover trial found that psyllium and loperamide were equally effective at reducing episodes. But loperamide caused constipation in 29% of participants versus only 10% for psyllium. One compound, two opposite problems. Comparable results to a dedicated anti-diarrheal drug with fewer side effects. Researchers have called psyllium the gold standard of bowel regulation. And for once, that phrase comes from a peer-reviewed systematic review, not a marketing department. And we haven't even gotten to what this gel does to your cholesterol panel. That's a different mechanism entirely, and it involves hijacking your liver's recycling program. Second, the bile acid trap. Have you ever wondered why your doctor keeps telling you to eat more fiber for your heart? The answer is bile, and psyllium plays the dirtiest trick in the digestive playbook on it. Here's how it works. Your liver manufactures bile acids from cholesterol. Those bile acids get squirted into your small intestine to help digest fats. Normally, about 95% of those bile acids get reabsorbed at the end of the small intestine and recycled back to the liver. It's an efficient loop. Psyllium's gel breaks that loop. The arabinoxylan matrix physically binds bile acids inside its structure, escorting them out of your body in the stool instead of letting them return to the liver. Now your liver needs raw material to make replacement bile acids. Where does it get it? From LDL cholesterol in your blood. Your liver literally pulls cholesterol out of circulation to cover the deficit. The numbers are solid. A meta-analysis of 8 controlled trials found that 10.2 grams of psyllium per day, on top of a low-fat diet, lowered total cholesterol by an additional 3 to 6% and LDL cholesterol by 5 to 9%, with no effect on HDL or triglycerides. That evidence was strong enough for the FDA to authorize a health claim under 21 CFR 101.81. As part of a diet low in saturated fat and cholesterol, 7 grams or more per day of soluble fiber from psyllium seed husk may reduce the risk of heart disease. But here's the part that should make you pause before doubling your dose. A December 2025 dose-response meta-analysis of 41 randomized controlled trials found something the supplement industry doesn't want you to hear. The data did not show a clear linear dose-response relationship for cholesterol reduction. In practical terms, the evidence so far does not support the idea that taking more than 10 grams per day will keep pushing your LDL lower and lower. Your liver's recycling system appears to have a ceiling, and once you've approached it, extra psyllium is just extra gel with diminishing returns. More research may refine this picture, but for now, the takeaway is simple. Follow the established dose, not the more is better instinct. That's the cholesterol story. But there's a second metabolic front where psyllium has been quietly making a case for itself, and it involves the hormone that Ozempic was designed to mimic. Third, ancestors knew first. From the Thar Desert to your medicine cabinet. The name isabgol comes from the Persian words isap and gol, horse ear. Hold a Plantago ovata seed in your palm, and you'll see why. It's small, boat-shaped, and slightly concave, like a miniature ear tipped sideways. That name traveled the same trade routes the seed itself did, from the Mediterranean basin through Persia, across the Arabian Peninsula, and deep into the Indian subcontinent. The classical Ayurvedic texts, the Charaka Samhita, the Sushruta Samhita, do not mention isabgol by name. It enters the written record later, in medieval compendia, like the Bhava Prakasha Nigantu in the 16th century, where it is described as lagu, light, snigdha, unctuous, and madura, sweet. Traditional healers prescribed it for anaha, trapped intestinal gas, and atisara, diarrhea. They also used it as a preparatory agent before virechana, the therapeutic purgation step in panchakarma cleansing rituals. Soften the stool before you flush the system. A remarkably practical piece of ancient protocol. By the 18th century, Muslim hakims and Hindu vaidyas alike were prescribing isabgol. Unani physicians adopted it as a mild expectorant for coughs, not just a digestive aid. In traditional herbal shops in Cairo, the seed was sold as a contraceptive, a use that has no modern clinical support, but tells you how broadly this plant was trusted across cultures. The British colonial apparatus recognized the commercial potential. Plantago ovata entered the pharmacopoeias of Bombay and Madras, and by the 19th century, small consignments were being exported. Today, India produces 80% of the world's psyllium supply. 90% of the processing happens in a single Indian state, Gujarat. Every container of Metamucil on every pharmacy shelf in America traces its supply chain back to the arid fields between Ahmedabad and Jaipur. One plant, one region, $400 million in annual exports. For American viewers, there's a domestic connection worth noting. Plantago ovata's cousin, Plantago major, common plantain, or white man's footprint, as some Native American tribes called it, was one of the most widely used wound-healing plants in colonial and frontier medicine. The Shakers cultivated it. Civil War field medics applied crushed plantain leaves to wounds. Same genus, different species, same family instinct. The Plantago clan has been showing up in human medicine for longer than we've had the word medicine. But those ancestors didn't have warfarin prescriptions. They didn't take levothyroxine every morning. And they never imagined a world where a teaspoon of seed powder could block a man's esophagus and kill him. That's where the danger zone begins. Fourth, the danger zone. I need you to hear this part clearly, because it is the difference between a useful tool and a trip to the emergency room. The choking risk is real, and it is documented. In 2022, a case report in the World Journal of Clinical Cases described a 76-year-old man with Parkinson's disease who swallowed psyllium husk powder and developed acute esophageal obstruction. The powder formed a bezoar, a hardened mass, near the gastroesophageal junction. It had to be removed endoscopically. ISMP Canada published a safety bulletin documenting a fatal choking incident caused by inappropriate administration of psyllium to a patient with dysphagia. The mechanism is simple and brutal. Psyllium swells on contact with liquid. If it starts swelling in your throat instead of your stomach, it can block your airway. This is not theoretical. People have died. Rule number 1. Never take psyllium dry. Never. Not as a dare, not because you're in a hurry, not because the capsule got stuck. Every dose must be mixed with a full glass of water, at minimum 8 ounces, 240 milliliters, and swallowed immediately before it begins to gel. Follow it with another glass. If you have any history of swallowing difficulty, esophageal narrowing, Parkinson's disease, or recent head and neck surgery, do not take psyllium without explicit approval from your physician. Now for the drug interactions. Psyllium is not pharmacologically active in the way that, say, St. John's wort is. It doesn't mess with your cytochrome P450 enzymes. It doesn't alter liver metabolism. Its mechanism is cruder, but just as consequential. That gel physically traps medication molecules and carries them out of your body before they can be absorbed. Think of it as a molecular kidnapper. It doesn't care what the drug does. It just wraps it up and escorts it to the exit. Here are the specific interactions that matter for this audience. Levothyroxine, Synthroid. If you're on thyroid medication, this is the big one. One study showed a 9% reduction in absorption when taken simultaneously with 3.4 grams of psyllium. 9% sounds small, but levothyroxine has a narrow therapeutic window. Clinical evidence shows that patients on high-fiber diets may need higher doses to maintain normal thyroid function. The recommendation? Take your levothyroxine first thing in the morning on an empty stomach. Do not take psyllium for at least 4 hours afterward. Lithium. Case reports show that psyllium decreases lithium absorption. Given lithium's notoriously narrow therapeutic range, this is not something to experiment with. Separate doses by at least 1 hour, preferably 2. Carbamazepine, Tegretol. Psyllium reduces both absorption and serum levels of this anticonvulsant. If you're on carbamazepine for seizure control, timing is everything. Digoxin. Psyllium can bind digoxin in the gut, potentially dropping blood levels to subtherapeutic territory. For a cardiac patient, subtherapeutic digoxin is not a minor inconvenience. It's a medical emergency waiting to happen. Metformin. Here's a paradox. While psyllium reduces absorption of most drugs, some evidence suggests it may actually increase metformin absorption. If you're on metformin for type 2 diabetes, this could amplify the blood sugar lowering effect beyond what your doctor prescribed. Monitor closely. Warfarin, Coumadin. The interaction here is rated as moderate. Sudden changes in fiber intake, starting or stopping psyllium abruptly, can shift how warfarin behaves indirectly. If you're on blood thinners, any dietary change involving fiber should be discussed with whoever manages your INR. Blood pressure medications, lisinopril, losartan, amlodipine, and others. Psyllium itself may modestly lower blood pressure. Combined with antihypertensive drugs, the additive effect could push your numbers too low. The universal rule? Take psyllium at least 2 hours before or 2 hours after any oral medication. For levothyroxine, make it 4. No exceptions. One more danger that doesn't get enough attention: occupational allergy. A case in the medical literature describes a 57-year-old pharmaceutical worker who developed asthma from inhaling Plantago ovata dust on the production line. If you work with bulk psyllium powder, or even if you're mixing it in a small kitchen with poor ventilation, the airborne particles can sensitize your lungs. Rare, but real. A note before we continue. This is not a replacement for medical care. Nothing I describe in this section is a substitute for your doctor's guidance. If you take prescription medication, especially thyroid medication, blood thinners, seizure medication, lithium, digoxin, or diabetes drugs, timing matters, and your physician needs to know you're adding psyllium to your routine. The information below comes from published clinical literature and FDA labeling, not from me playing doctor. Finally, the protocol. How to use psyllium correctly. If you've made it this far, you know the benefits and you know the risks. Now let's talk about how to actually use this thing without turning a helpful fiber into a problem. Starting dose: 1 teaspoon, approximately 3 to 3.5 grams, mixed into a full glass of water or juice, 8 ounces minimum. Stir briskly and drink immediately before it gels. Follow with another full glass of water. Do this once per day for the first week. Building up. Increase by 1 teaspoon every 5 to 7 days. Your gut bacteria need time to adjust. Jumping straight to a full dose is how you end up bloated, gassy, and convinced the stuff doesn't work. Maintenance dose for general digestive health: 1 tablespoon, roughly 7 grams, once or twice daily, always with a full glass of water. Cholesterol management. The FDA-backed dose is 10.2 grams per day, which works out to about 1 tablespoon 3 times a day, taken before meals. But remember what the meta-analyses showed. The dose-response curve flattens. Follow the established guidelines, rather than the more is better instinct. Blood sugar management. The clinical studies that showed the best glycemic results used psyllium dosed before meals. 3.5 grams, roughly 1 teaspoon, stirred into water and consumed 5 to 10 minutes before eating. The viscous gel needs to be in place before the food arrives. Temperature. Use cool or room temperature water. Hot water causes the gel to form too fast, making it clumpy and harder to drink. Some people mix it into smoothies, but be aware that the gel can thicken the smoothie dramatically within a few minutes. Drink it quickly. Forms available: powder, most versatile and cheapest; capsules, convenient but require even more water, at least 12 ounces, since the capsule dissolves and swells inside you; and whole husks, for baking, works as a gluten-free binder and egg substitute. For the cholesterol and blood sugar benefits, powder before meals is the gold standard. What to watch for? Mild bloating and gas in the first week are normal. If you experience severe cramping, inability to pass stool, or difficulty swallowing after taking psyllium, stop immediately and contact your doctor. These could signal obstruction. The cost. A 30-day supply of psyllium husk powder runs between $8 and $15 at most American pharmacies. Compare that to the unpredictable cost of prescription drugs, especially newer metabolic medications like GLP-1 agonists that can run well over $1,000 a month. Psyllium is not a replacement for a statin or a GLP-1 drug, and I want to be absolutely clear about that. But as an adjunct to the treatment plan your doctor has you on, the cost-to-benefit ratio is hard to beat. There's a strange humility to Plantago ovata. It grows in desert soil where almost nothing else will. It lives for 130 days, and then it's done. Its seed is so small you could lose 100 of them between your couch cushions. And yet this modest annual herb from the wastelands of Rajasthan has managed to earn an FDA health claim, match a dedicated anti-diarrheal drug in clinical trials with fewer side effects, alter the gut microbiome in ways we're only beginning to understand, and become the centerpiece of a $400 million global supply chain controlled almost entirely by one Indian state. It is also, if you use it carelessly, fully capable of blocking your esophagus and killing you. That's the deal with everything in this archive. The gel that softens your stool can harden in your throat. The fiber that lowers your cholesterol can kidnap your thyroid medication. The seed that fed Ayurvedic medicine for 5 centuries can suffocate a man in the 21st. Everything is poison. Everything is medicine. The dose and the glass of water makes the difference.